relation to good partnerships, I think it's really important to leave ego at the door. So for myself, in a health perspective and touching on that person-centred care, I appreciate that health and hospital service staff, they do have expertise, they have their training, but also every person is an individual and they have expertise in their own life. So for me, it's an acknowledgement and working together and a respect between both consumers and health service staff, that they really utilise both of their strengths and work together. So I think leaving ego at the door and focusing on strengths is the best way to have a good partnership.
When we're talking about partnering with consumers and what good engagement looks like, we're not just talking about one kind of engagement. We talk about a whole range of mechanisms and using mechanisms that are most appropriate at the time. Sometimes consumers might just be involved in one-off focus groups, but there are also great benefits to be had from long-term relationships between consumers and health services that build trust, build knowledge of how the health system works, and create an understanding of what consumers truly want from health services.
Given my experience, good partnerships are certainly ones where the health service or the private community's health service and the consumers can work together, and consumers can have the confidence to voice their opinion and know that it is being heard and acted upon. The good partnerships enable consumers to co-design services. So for example, within our CF unit, we have organised exercise equipment in all our single bedrooms because we didn't feel safe going to the gym together.
It's very important for there to be consumer participation on committees. It's absolutely vital. I'd like to read from a statement by a sociologist called Peter Berger. And he says what people have to say about their own reality must be taken with great seriousness. Not only because this is morally right, but because failure to do so can lead to great and catastrophic consequences. As I see it, he's saying that lip service is not an option for effective communication and participation.
For health services to effectively partner with consumers, it's really important that the leaders who run the services and the people delivering the services engage directly with consumers and consumer representatives. I think it's really important that consumers have representation and networks to inform their position. I've found it really ineffective when consumers are trying to engage with a service through consumer liaison staff and that sort of thing. It's about directly connecting the consumer perspective with the people who are delivering the services and who've got the power to make decisions about the services.
Probably the main thing that gets in the way of good partnership is the way it's always been done. As in red tape, bureaucracy, that type of thing. Many clinicians are the whole consumer engagement field, if you like, is very new, really, for a lot of hospital services. For doctors to listen to patients, tell them what they want and then redesign the service around that is many clinicians are resistant to do that. Many clinicians will feel that they know best, they're the doctor. And so that's probably been the biggest barrier. I think another thing that's often a barrier to having people speak up or have the confidence to speak up and suggest improvements is they're worried that their care will be compromised if they make not even a complaint but a suggestion, to say, well look, I didn't like the way Nurse X did that for me. And I think that's a big barrier for a lot of consumers to actually become involved because they're worried that they're going to be painted as a complainer or whatever.
And I think another really big obstacle to effective engagement is interpersonal skills. It all ends up coming down to people being able to engage effectively with each other. And that goes both ways. For consumers who might feel really angry about something because of their experience or just not know how to navigate the system, they need to develop the skills to be able to engage and for hospital leaders to learn the corresponding skills on how to put aside the stresses of their management roles and hear what consumers have to say. That's quite difficult for both of them.